Hello, my name is Brianna Armendariz-Diaz, and for my disease report, I will be presenting on mononucleosis, which is also commonly known as mono for short. This infection is also known as the kissing disease because of its common mode of transmission, but I'll get to that later. So, mononucleosis is caused by the Epstein-Barr virus, which was discovered in March of 1964 by Anthony Epstein and Yvonne Barr upon studying Burkitt's lymphoma, which is a very rare yet aggressive disease in which the body creates abnormal B lymphocytes. The Epstein-Barr virus is a type of herpes virus and is a subfamily of the gamma herpes virus. Epstein-Barr virus is also commonly known as EBV for short, and it's also referred to as the human herpes virus 4. With up to 50% of all children up to the age of 5 and about 90% of adults in the US alone, EBV is a virus that affects any individual at any point in their lifetime without having to show symptoms. Also, humans are the only known reservoir for this virus. Epstein-Barr virus is a DNA virus that affects and hijacks B cells and epithelial cells alike by changing their cellular function. This virus has an incubation period of an average of 4 to 6 weeks after the person has been infected. After this time, symptoms may or may not show, however, the person can still infect and spread throughout others. Once the person has been infected with EBV, typical symptoms of mononucleosis will begin to appear. As previously mentioned, a person with the virus has the ability to transmit the infection to others during the incubation period with or without symptoms. Common mode of transmission for this virus or for this infection is through body fluid, especially through the saliva, which is why it's commonly known as the kissing disease. However, there have been rare cases that semen during sexual contact, blood transfusions, and even organ transplants can carry mononucleosis and infect others. There also have been cases where pregnant women have gotten mono and the newborn is detected to also have it. However, it's unknown whether the newborn got it from utero or through the delivery process. Now, I know we all heard the phrase sharing is caring, but in the case of mononucleosis, it is not because sharing is a very easy way to become infected with the disease, such as sharing objects like lip balms and lipsticks, water bottles, toothbrushes, utensils, food, and drinks. Although the most the age that's most at risk is 15 to 24-year-olds, this does not limit mononucleosis because younger children, such as babies and toddlers, are still able to become infected with mono by coming into contact with toys that have been drooled on by an infected individual. As mentioned previously, the ages 15 to 24 is the age in which individuals get mono the most. However, mononucleosis and college students have a very special bond, not because of all the kissing that goes around, but because college students live in very close quarters to one another, and sometimes with roommates that may be asymptomatic with EBV. Another reason why it is so prevalent in colleges is because students are always sharing items like makeup products, which include lipsticks and lip balms. And for all my college athletes out there, the water bottles and the sports drinks too. However, another reason why mono is so prevalent in college students is because of the cafeterias. This is because sometimes reusable utensils, plates, and cups are not properly sanitized, which can cause the infection to spread rapidly among students and staff. So there are three main stages of mono, which can be broken down into the prodrome stage, the acute stage, and the convalescent stage. All of these stages occur after the incubation period that takes upwards to 4 to 6 weeks with no signs of symptoms or infection. However, as mentioned, the individual is still able to transfer the virus and infect others. So the first stage, the prodrome stage, is when symptoms related to the common cold and strep are going to begin to show. These include being fatigued, loss of appetite, having a sore throat, and the possibility of developing a fever. Overall, during this stage, the person will begin to not feel so well and not feel their usual self. This stage typically lasts 3 to 5 days. However, it can take upwards to 14 days. One can begin to take cold medications, such as an over-the-counter like Dayquil or an ibuprofen, or a prescription like amoxicillin, but unfortunately, they will not stop or lessen the effects of mononucleosis. The second stage of mono is the acute stage. During this time is when symptoms begin to worsen and the classic signs of mono will begin to show on the person. This includes enlarged lymph nodes on the side of the neck, white patches on the tonsils, high fevers reaching up to 105, and this stage typically lasts 2 to 4 weeks, and this is when people are the most contagious. The last stage of mono is the convalescent stage. During this time, the infected person will begin to recover from their symptoms and they will lessen. This stage lasts the longest out of all of them, with a time period of 3 to 6 months. However, even though symptoms may not show anymore, the person can still be infected upwards to 18 months or more, depending on the situation. Mononucleosis can be diagnosed by the symptoms, getting a physical exam, and having a blood test done, which is the most common way and the most sure way to find out whether or not you have mono. As mentioned previously, mono does have classic symptoms that are easily detectable upon appearance. The beginning symptoms are very similar to strep and the common cold, like the swollen, patchy tonsils, as seen on the top right. This is known as tonsillitis. A sore throat, feeling tired, decreased appetite, and headaches, as well as high fevers, chills, and the overall feeling of uncomfortableness. However, as symptoms worsen, a person can develop a rash, as shown on the bottom right. And a very common sign of mono is the swollen lymph nodes. Unfortunately, I think my camera is blocking the picture, but these lymph nodes located on the side of the neck can become swollen as big as or bigger than a golf ball. Even though mono is usually not life-threatening, there have been extreme cases where complications occur alongside the mononucleosis. Such include when a person develops jaundice, which is shown on the top left with the yellow eyes. This is when a substance called bilirubin builds up and causes the skin and the white of the eyes to turn yellow, as again shown in the picture. Jaundice is normally always tied with some sort of liver failure. This can range from acute to a more complex liver failure. Another complication that can occur is encephalitis, which is when the brain begins to become inflamed. And the last complication that can occur is a splenic rupture when the spleen ruptures, which is why college athletes that do get mononucleosis are asked not to return to their sport until 1 to 2 months after symptoms have completely stopped. When these extreme cases occur and are left untreated or not detected on time is when there could be a fatality. However, this is only less than 1% of cases. So, unfortunately, there is no current cure or proper treatment for this condition. Mononucleosis usually goes away on its own with a lot of time and a lot of rest. However, there are treatments that can relieve the pain relieve the symptoms or lessen the symptoms, which include drinking plenty of fluids like water and Gatorade and electrolytes. Again, getting lots of rest, taking medicine to relieve the pain and fever like an ibuprofen or a Dayquil, and medicine like corticosteroids to reduce the swelling in the throat that can cause trouble breathing and swallowing. Unfortunately, antibiotics like penicillin and amoxicillin will not work against mononucleosis. Instead, they have the possibility to make complications like a rash worse. Thank you.